Hello and welcome once again to In Depth, where this week we are focusing on the corona fight back. We've spoken on issues like plasma therapy that is helping people to recover. Today our focus is on quarantine centers and how best you must be prepared for life either in a quarantine center or indeed in an ICU hospital. With over 68,400 cases, it's the maximum city Mumbai where we are starting our show today. While at present the city is testing 4,500 people every day with the launch of the newly launched Mission Universal Testing, another target has been set of 6,500 tests per day. With more tests, what the city will also need will be more centers to quarantine patients. As we focus on quarantine centers, the question we want to ask, how prepared is a city like Mumbai for the steady influx of patients? Our correspondents Vidya and Mustafa Sheikh find out.
The numbers in Mumbai are coming down, but it is still the city with the maximum number of COVID cases. Not letting their guard down, the Mumbai Municipal Corporation on Tuesday announced the launch of its universal testing mission and treatment. It is also arranging for quarantine centers at a rapid pace, it says.
It was in the first week of May that Iqbal Chahal took over the office of the Mumbai Municipal Commissioner. He channelized the corporation into working towards containing COVID-19 cases in slums. Those who lived in high-rises and could afford home isolation were asked to home quarantine, while in every positive case in slum, there were at least 10 people who were picked up and quarantined. Over the number of days, this ratio has only increased.
टेस्टिंग की जाएगी, अगर उसका रिपोर्ट पॉजिटिव आता है तो 1 का 20 इस रेशियो में हाई रिस्क कॉन्टैक्ट को ट्रेस करके उनको गवर्नमेंट क्वारंटाइन में भेजा जाएगा.
Initially in March, the Kasturba Gandhi Hospital was the lone treating and isolating center in the city for COVID-19 patients.
खाना ठीक नहीं था, कच्चा आता था, चावल रोटी सब कच्चे आती थी. दूध देते थे शाम को, बट 2 घंटे के बाद वो खराब हो जाता था.
But with the rise in cases and complaints about conditions at the center, hotels were taken up for quarantine and isolation purposes. And gradually, many empty buildings, hostels, and even indoor stadiums like the NSCI in Worli were converted into quarantine centers. Following the Wuhan model, where makeshift hospitals were built in open spaces in the month of May, many more structures came up in Mumbai, and that too within the span of a few days. Medical quarantine facilities in Mumbai are divided into 2 categories. The first being CCC-1, which quarantines high-risk suspects and has a bed capacity of 47,999. In CC-1 at present, there are 17,614 beds which are occupied. The second category is CCC-2, which is meant for asymptomatic positive cases and people with mild symptoms. Bed capacity of 24,736, of which at present 2,999 beds are occupied. The BMC says that more jumbo quarantine and care facilities will be added, like the one that is under construction at Baikula. The city at present has 30,000 active cases, so for the time being, it seems that Mumbai has its quarantine beds under control. This report filed by Mustafa Sheikh and Vidya in Mumbai for India Today TV.
And to get a sense of how the city has prepared for quarantining patients, I'm joined by Dr. Rajeev Joshi, gastrosurgeon at Nair Hospital, but one of those running the NSCI Dome facility at Worli, the first contactless COVID positive facility. Appreciate your joining us, Doctor. Give us a sense of where we are in terms of high quality quarantine centers and COVID hospitals that have been built in the last couple of months to cater to surge capacity. What makes the NSCI Dome, for example, stand out in comparison to other facilities?
Yeah, thank you, Rajdeep. The point here is that we have now started a state-of-the-art makeshift ICU facility, what we call the portable containers. Now, the technology involved here is that we'll have the patients in these sort of containers, and then we'll be monitoring them from a control room, which is about 20-25 feet away. The idea being that there'll be less contact between the healthcare workers and the patients. Of course, it is not that it's going to be completely contactless, because some of our doctors would still be inside, attend to the patients, and then they'll be coming out, and the senior doctors would be sitting in the control room and monitoring the situation. So, this is a disease where technology has been challenged, and this is one of the technological innovations that we are trying to put across. And of course, it's early days yet, but I'm sure that with a lot of hard work that has gone into it, and a lot of support which is coming through the state government and the Bombay Municipal Corporation, I'm sure that we're going to take this further.
Tell me now, doctor, who comes to these facilities? Presumably you are taking critical patients here. Those with mild symptoms are still advised to focus on home quarantine. Am I correct?
Yes, that's the thing. But obviously there'll be patients even at home quarantine. They may not be in a small setup, in a small house. They may not be able to self-isolate them well. So that is why they set up these COVID care centers and isolation centers. But the NSCI has moved one step further in that we are now converting into a sort of makeshift hospital. And that is why the ICUs are going to be important. If you see the trend which is going on in the city is more and more people are home quarantining. But the patients who are becoming serious, they need hospitalization, and quite a few of them need an intensive care management. And that is where this makeshift facility is a new addition in the whole gamut of management.
And presumably you have oximeters, ventilators, the entire works available here which someone would not have in a home quarantine. What is the stage, doctor, that you advise people to actually consult medical practitioners and consider moving from home quarantine to, let's say, one of these makeshift COVID care centers?
Yeah, absolutely. So you could have a patient who is positive and asymptomatic, and that patient could easily be at home. But a patient who is positive, and even if he is mildly symptomatic, he needs to seek medical attention. A patient who is going to be positive and is going to be symptomatic is obviously going to come on his own. And then there's the fourth category of patients who are going to get breathless, whose oxygenation is going to suffer, and these are the patients who then require hospitalization.
Doctor, there was a concern till a few weeks ago. Will Mumbai have enough ventilators? Will there be enough oximeters? Will there be enough oxygen available, oxygen cylinders? Are all those problems now under control? There seem to be enough beds at the moment, but what about enough ventilators and enough oxygen cylinders?
Yeah, see what happens, Rajdeep, is that the dynamics keep on changing every day. Now suddenly you have a spurt of patients, on that day you might have a shortage. But on other days when the patient load is less, we are well equipped. So because of changing dynamics, one can really not reach an optimal level of supplies. But I think we're doing, under the circumstances, we are doing the best as anywhere in the world.
In Bombay we've seen, or in Mumbai we've seen 5-star hotels being taken over and converted into COVID care centers. We've seen a stadium like NSCI being converted, MMRDA grounds are being converted. In a sense, would you still advise patients to first try and go to a hospital before you consider moving them to a hotel or moving them to a COVID care center at NSCI?
Yeah, that is the concept of quarantine that we are talking about. So now, if you see the recent trend, the trend is more towards home quarantine. But if a patient is not able to self-quarantine at home, or if he has people around him who's he's going to be in close contact with because of small spaces available, obviously they're going to be accepted and they're going to be admitted in these quarantine centers.
And you, with the NSCI Dome, with this contactless facility, have you minimized the risks therefore? Any risks that may be involved in patients, and both for the patients and the health workers? Do you believe the risks have now got minimized of staying in these quarantine centers?
Yes, absolutely. I mean, as far as the patients go, definitely. And as far as the healthcare workers go, with innovations in technology like what we follow here at the NSCI, where we're talking about not 100% contactless, but minimum contact facility, the infection rate in the healthcare workers is to the bare minimum. And that's why, even a person like me who's 61 years old and, still at the front line managing patients. So, although I wouldn't be in direct contact with the patient, I'm still able to manage them because I can see them from my control room, I can monitor them, and if there's any problem, I can advise my frontline workers how to go about it.
Well, Dr. Joshi, you and your team are doing an incredible job. Thank you very much for joining us and giving us a sense of what it's taken to set up these world-class makeshift COVID care centers. Thank you so much, Dr. Joshi, and more power to you and your team there in Mumbai.
Rajdeep, I just need to add one more line.
Please do.
Yeah, I think the most important thing is we dedicate this to the city of Mumbai.
Well, all I can say is more power to you, a city that one has a deep emotional connect with. Thank you very much, Doctor, for joining me there from Mumbai. Meanwhile, even in the last few hours, Delhi has taken over from Mumbai. This is now the city. The national capital is now the country's corona capital, the maximum number of cases. And the tussle here over quarantine rules continue to simmer. After opposition by the Kejriwal government, the Delhi Lieutenant Governor Anil Baijal has withdrawn his order last week, making 5-day institutional quarantine mandatory for COVID-19 patients. Now the Delhi government has written to the Home Minister Amit Shah for a rollback on home quarantine rules. Take a look.
In the biggest single-day spike in COVID cases, Delhi recorded 3,947 new cases in just 24 hours, taking the total number of cases over the 66,000 mark. 68 deaths were also recorded within 24 hours. Even Maharashtra, which has more than double the number of cases in Delhi, has never reported these many new infections in a single day. The number of cases in Delhi have rapidly increased by almost 5 times when compared to a month ago. And as these numbers began climbing, it led to confusion in the government over quarantine rules. First came the order that all COVID-positive patients will have to go through a mandatory 5-day institutional quarantine. The order came on 19th of June from Delhi's LG, Anil Baijal.
We had our...
But it was immediately opposed by the Delhi government. In a meeting with the Lieutenant Governor, Delhi Chief Minister Kejriwal asked why a new rule was being brought for Delhi when ICMR allows home quarantine for patients with mild symptoms. Kejriwal argued the new order would discourage people from taking COVID tests. He also raised the issue of shortage of medical staff. Owing to the opposition from the government, the LG scrapped the order. Instead, the rule now says once a patient tests positive in Delhi, they have to visit a health center to ascertain if they are eligible for home quarantine. The clarification brought some relief, but the AAP government wants norms restricting home quarantine to be rolled back as well, claiming it was still causing confusion among patients. The Delhi government has also written to Union Home Minister Amit Shah demanding a rollback in the home quarantine rules.
मैंने एलजी साहब को एक चिट्ठी लिखी है कि उनके आदेश से दिल्ली में एक नई व्यवस्था जो लागू हुई है जिसमें कोरोना के हर पेशेंट को पॉजिटिव पाए जाने पे क्वारंटीन सेंटर जाना पड़ेगा उस व्यवस्था को बदलें उसकी वजह से अफरा-तफरी मच गई है.
The Delhi government is vehemently opposed to the Lieutenant Governor's order of all COVID-19 patients to be taken to the COVID care centers for assessment. Now, the Delhi government says neither do they have the resources like ambulances and staff to carry out this mammoth exercise, nor the patients are willing to go to the COVID care center for assessment. Now, this is resulting in many patients not coming forward, which in turn is creating a problem of a different kind. Should the government now use the powers under the DDMA Act to force these patients, or can there be a middle ground?
In a bid to address the rising cases, Home Minister Amit Shah said that a 10,000-bed facility will be readied by the ITBP at their campus in Chhattarpur and will be operational by June 26th. Meanwhile, the Delhi government has also decided to ramp up testing with house-to-house screening as part of the state's COVID response plan.
Now, with a view to the rising COVID-19 cases in the national capital, many resident welfare associations, or RWAs as they are called, have also declared their own war against the virus. The RWAs now are coming up with quarantine facilities inside their societies. Take a look.
Delhi is bracing for a surge in coronavirus cases, with the state government asking patients with mild symptoms to isolate themselves at home. Many residents' welfare associations are stepping forward to help. The Narmada RWA in Greater Kailash, for instance, has converted a community centre into a quarantine facility.
So when I enter in this quarantine room, which was earlier a community center, hardly was used, but now it's almost a makeshift 4-bed hospitals. And look at the way it has been decorated. So what all you see in the quarantine center, 2 air conditioners, and that's also the arrangement by the RWA. You see the air conditioners made, and now again for the isolation and separation, the curtains, which will be isolating 2 beds from each other. So here you have a bed with pillow cover, sheet, blanket and everything that one would require in the isolation. Along with that, there you see the reading lamp, that's a charger point, tissue paper, glass, bottle, disposal dustbin, and also the chair. So that's how you see this makeshift quarantine center. In case of emergency, there I see even the oxygen cylinder. Remember the kind of treatment that may require, and even in the case of emergency, if there is no hospitalization immediately provided, those serious patients, particularly in these residential colony, can also be accommodated at least for 24 hours.
The facility has 4 beds and looks nothing less than a hospital.
So we thought let's have a makeshift arrangement where till the time a person gets a bed, we are ready for it. No, we cannot. It is very important that in any emergency situation there should be a basic amenities available to our resident, where we can give them oxygen, we can give them doctor coming in, nurse taking care of it.
A similar facility is set up in Antariksh apartment of Rohini's Sector 14. The facility has oxygen supply along with medicines.
प्राइमरी बेस पे कोई भी पेशेंट अगर कोई दिक्कत आती है तो सब तरह की फैसिलिटी है. अगर उसको हॉस्पिटल में जगह नहीं मिलती तो यहाँ पे हमने सारा सिस्टम इस टाइप का कर दिया है. उसको ज़्यादा परेशानी नहीं हो तब तक हम यहाँ उसको रख सकते हैं, उसका पूरा इलाज कर सकते हैं. हमारे पास डॉक्टर भी हैं, हमारे पास नर्स भी हैं.
The RWA of Ganga apartment in Vasant Kunj has set up a 13-bed isolation ward. The RWA says, if needed, the community centre will also be converted into a quarantine facility.
आपके घर में किसी भी तरीके की रहने की दिक्कत है, बुजुर्ग हैं या बच्चा है, किसी को भी ऐसी दिक्कत हो तो हम उनके लिए ये जगह प्रोवाइड करेंगे. और ये मैं चाहूँगा कि बनाया बेशक गंगा ने है, लेकिन ये सुविधा हमारी पूरी एक्सटेंड होगी. चाहे गंगा, यमुना, नर्मदा, सरस्वती, जो भी इसमें जो भी मुसीबत में होगा, हम उसकी मुसीबत के लिए सामने खड़े रहेंगे.
Delhi is the second worst affected state after Maharashtra, with the state government projecting 5.5 lakh cases by July end. Each of these beds will count. Bureau Report, India Today.
So from stadiums in Mumbai to RWAs in the national capital, and Chennai too, another city, is gearing up with its own quarantine centers. We'll have more on all of that as we continue to focus this week on how cities are fighting back against corona. Thanks for watching. Bye for now.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.